sildenafil, Viagra versus tadalafil, which is Cialis, for sex and more. Which one to use? As a sole agent, or can you use it combined? Today I'm doing a response video from another doctor, an excellent doctor who has a huge YouTube channel, definitely a big fan of her, Rena Malik. This is from December 3rd, 2021. I have to do it because she's a great urologist. Now, I'm a medical doctor. She's a surgical doctor. She's a pelvic surgeon, and she states that. But she obviously, urologists know, it's funny that it's a woman, right? That they specialize from the kidneys all the way down into the pelvis, prostate, and the penis and the testicles and prostate cancer and kidney cancer and surgery. I could tell you this. So she's focusing her life on this stuff and helping men, which is super cool. And she puts together really informative videos. So I want to start off from the part of her video, late in the video, where she's talking about the data, where she likes this data and she makes her own decision. Is it sildenafil or is it Cialis, Viagra versus Cialis? Which one how she likes to make that decision. I'm going to talk about that after with all the side effects and some more medical information, and then how you can use it together very carefully based on data. Here we go. Let's listen to Dr. Malik.
That I found comparing sildenafil and tadalafil head to head. I looked at a meta-analysis, and if you're new here, I love meta-analyses. Meta-analyses are studies that look at all the published data on a certain topic, and they do a systematic review, which means they look at the specific data from all of the studies, combine it together, and that makes for a much stronger study. So you can really look at those outcomes and say, well, this is what 10 or 15 or 20 studies said, so this must be more valid than just one study by itself. This particular meta-analysis and systematic review looked at sildenafil versus tadalafil and looked at any study that compared them head to head. And they had to use a specific validated questionnaire to compare their erectile dysfunction outcomes. They couldn't just say, hey, were your erections better? They had to use a questionnaire that has been looked at and validated to show a difference, a clinically meaningful difference in erectile dysfunction outcomes on medication. In this particular review, they include 16 studies with over 5,000 patients. So what they found was that efficacy, as I mentioned earlier, was about the same in both groups. But in this, they also looked at how the partner felt their erections were, as well as the patient's treatment satisfaction and adherence, or sticking to the medication or using it regularly with either sildenafil or tadalafil. People in these studies who took tadalafil tended to have better self-esteem in their relationships and were more satisfied with their treatments. And in 9 studies, they looked at preference. They asked them, what do you prefer? In 9 of these studies, they found that the men and their partners both preferred tadalafil over sildenafil. So what they found was that persistence and side effects were similar in both groups. The only difference in side effects were that sildenafil patients were more likely to have vision changes, whereas tadalafil patients were more likely to have muscle aches. So what do I recommend? Well, if you have urinary symptoms with BPH, well then I recommend taking 1 daily dose of tadalafil every single day. If you are willing to take an on-demand medication, try either one. And if one doesn't work, go ahead and switch to the other one. But always make sure you're doing this under the supervision of a physician.
Guys, there it is. Dr. Malik likes tadalafil if you have BPH and ED. Okay, guys, let's open up the discussion. Now, tadalafil versus sildenafil, Cialis versus Viagra. Viagra, first drug on the market way back in the 90s from Pfizer, and it was discovered, this class of drugs, PDE5 inhibitors, when they were looking at cardiac disease. That's why it's kind of more my medicine versus surgery. Very interesting that it was discovered because they were looking at angina, heart disease, right? Hypertension and vascular dynamics, right? And they discovered that it had a side effect profile, that it vasodilated and increased nitric oxide in the penis, better erections. Now we know that sildenafil also can be used in the hospital for pulmonary hypertension. And we also look at these PDE5 inhibitors from an endothelial health standpoint of increasing nitric oxide with that inner wrapping of the artery, that endothelial wrapping that I love so much with my ABCs, right? You know, my ABCDs, the A1C, glycemic index, diabetes, prediabetes, blood pressure, cholesterol, cardiac disease. This is a secret medications guide. This class is unbelievable for health and for longevity, but you have to really understand it. But the basis is sex and BPH. So what other side effects did Dr. Malik talk about that I want to review with you guys? So, and this is really going to be side effects related to the class of drugs, which there are 4, but we're looking at these 2 because these are cheap. They've been out there the longest. They're generic now. So with GoodRx, you can get this stuff super, super cheap, guys. This is amazing. And really, it's great stuff, right? I mean, the quality of the generic is super cheap. And I'd also recommend, while I'm on this topic, that you have your doctor or you order it from telemedicine with like the max dose. Don't use the max dose, but order it, and then there's no matrix that is time release in this. This is a big secret. So you could break them, cut them, and bite them in half. Typically the Cialis, the tadalafil, it's very, very chalky and it will crumble easily. And you could just seal the end and put it back, and you can just take pieces of it. And that's just going to be pennies. 40 cents for a 20 milligram tablet, that's the max dose. You could take half, so that's 20 cents. You take a quarter, it's 5 cents. Come on, guys. This is super, super important for you guys. Why would you go online and pay maximum 400% for this stuff just to get it when you could find a doctor or telemedicine to use GoodRx and get the stuff very, very cheap? So back to the side effect profile here. It's very serious, though, across the board with PD5 inhibitors. The dangerous stuff is going to be the coronary artery disease aspects, especially if you have significant coronary artery disease and you're on nitrates. That's going to be nitroglycerin, the old school nitro tabs, under the tongue for chest pain, old school stuff still out there, or we have different derivatives of mononitrates that we use for angina. Again, if you're on those drugs and that's in a medical record at the pharmacy, the pharmacist won't even give you any of these drugs. Or they're going to clear it. Like, is that medicine in the house? You can't have it in this. They don't even want it near each other because you could have dangerous precipitation of hypotension where your systemic blood pressure just massively opens up when you're on both these medicines, nitric oxide, guys. So you have nitrate, right? Drug, massive vasodilatation, blood pressure just tanks, your heart reflexes, tachycardia, and if you have heart disease, plaque unstable, even with a prior heart attack, or even if you haven't had a heart attack, you're talking about potential for a ventricular arrhythmia, and that's death. It's very rare, guys. It's very rare, but it's happened. That's why this is a massive contraindication, having nitrates used with heart disease with these PD5 inhibitors. Okay, next ones that are significant are priapism. That's the erection that lasts for more than 4 hours. I've seen it twice in 20 years on over 10,000 patients, and it was a guy that had genetic priapism. He had a genetic condition for it, congenital. It's amazing. Now, with the red blood cell stuff and with the polycythemia, with antigen-induced erythrocytosis on board, with other medicines, not to mention injections in the penis, this is stuff that's very serious. And I've seen men have to go to the ER and have urologists like this open up and drain the penis itself, because if you have that penis erect for more than 4, 6, 8, 12 hours, you're going to get damage and ischemic damage, permanent scarring damage to the penis, and your penis is damaged. Okay, very rare, guys. But again, you need to be aware of these mechanisms. Now, the lesser side effects in these classes are very, very true. Flushing, headaches, red eyes, GERD, dizziness, and of course, just general blood pressure. A lot of you guys, I know you're very smart, and you know that I love Bistolic, which is Nebivolol, which is a nitric oxide doning cardiovascular selective beta blocker. It's not metoprolol or atenolol, and it's an add-on drug typically to my ARB like telmisartan, and it's just an amazing combination that men that respond to these, that are appropriate once they try the best with diet, exercise, and weight loss. These are blood pressure medications. Really, there are secrets that actually lead to having better sex because of nitric oxide. Now, the side effects though, guys, is again, the heartburn, again, the flushing and the stuffy nose and the red eyes just looks like people have looked at me like, Doc, are you smoking dope all night or all day? What are you doing? Are you like wasted? And I'm like, no, I'm not. I take I take Cialis, and I take my Tadalafil. I'm being honest, guys. So, but the dangerous one I want to bring up is GERD. This medicine class, both Cialis itself or Viagra in the generic, or the other two that are out there, there's 4 medicines, PD5 inhibitors, that they can cause GERD. I really think Tadalafil is worse for GERD because it's so long-acting. It's a great long-acting drug. Take a daily dose. It stays around for a while, works great, but heartburn could be horrible, especially if you have heartburn like me. Now I have Barrett's, and you want to be safe. And if you have hiatal hernia, you're overweight, you drink coffee, you eat food that can make it worse, you open up that sphincter and you can get Barrett's, and it's so rare. It's rare, guys, but Barrett's is not rare, but the cancer, esophageal adenocarcinoma, if you have any of these symptoms and GERD, with or without these sex drugs, you need to get an upper endoscopy from a very good gastroenterologist, not to mention colonoscopies. Everyone at 45, not 50. Okay, thank you for that rant. I had to make that rant. But GERD of this drug class can be a rate-limiting step for so many of you guys. You just can't take it, Doc. The GERD is just horrible. You got to work around that. Now, so those are the side effects. You understand the drugs. One is very long-acting. They're both for sex. But Tadalafil is long-acting. It also is cleared for BPH, and she mentioned it. If you have erectile dysfunction and you have BPH, lower urinary tract symptoms, you should use one drug for 2 issues. Brilliant. So many urologists don't, I know they know it, but they use Flomax. These are great urology doctors. And then you're on this drug plus Flomax. Talk about dizziness, even dangerous dizziness. So that's a contraindication for, I don't like to use those 2 drugs. This is very complex. So if you're getting older, you want to, with or without testosterone, you want to use this for sex and BPH and urinary tract where you could open it up and flow better. You could use this every day, Tadalafil, for sex and to have less symptoms from BPH. I do it, guys. Definitely a secret of mine. Okay, so now that's a sole agent. You pick one or the other. And if you just want on demand, you could try Viagra, Sildenafil, or Cialis. Now, using them together, look at this study right here. PubMed 2015, Tadalafil 5 milligrams every day with Sildenafil 50 milligrams PRN as needed. So here's the data, guys, and I know she's going to agree with this. This is super conservative data, but you want to be careful. You can do, I remember years ago, 10, 20 years ago, certainly 20 years ago, 10 years ago, to combine these together, again, it was like breaking a law. Now, you'll see online pharmacies putting it in one pill. I think that's wrong. I think you use the medicines potentially. Who is going to use them combined? It's going to be a man with severe, pretty moderate to severe erectile dysfunction, and it's before he's using the injection therapy or a prosthesis, and you're suffering. And you understand all your ABCDs, the A1C, the blood pressure, the cholesterol, your heart, get a calcium score. Remember, check the GERD, get an upper endoscopy, get your colonoscopies, have a great doctor, come to the app, Anabolic Doc, app.com. I'm a primary care doctor just for you guys, just for men. The sex is important. Here's what you can do. Be careful. You could use a low daily dose of Tadalafil, just like the study. 5 milligrams, even 2.5, that's really based on the literature. And then you inch upward easily. Hopefully you don't have side effects, including GERD and dizziness, and you're not looking too red. No one's calling you out for being wasted. And you tolerate it. And then when you're ready to have sex, if you want to have maybe one orgasm or maybe a few hours later, late that night or in the morning, you know you have that drug in the system, and you could throw on an additive PRN dose as needed of the short-acting Viagra. Boom, guys. 25 milligram, 50 as in the study, or even 100. But the more you add these together, guys, it's going to be synergistic, not just for the erections, because the studies showed it's true. It is true, and I use it for my patients very cautiously, kind of a last-ditch effort, kind of, so to speak, and very minimally and man per man. I watch them like a hawk. So I just make sure they understand all the side effects. But if you're using the low dose and you're on the tadalafil every day and you're adding these small low dose hits of the short-acting Viagra, it works. But again, the side effects are going to be additive from the headache, the dizziness, the flushing, the GERD, and then the potential super massive nitrate contraindications with the coronary disease and the priapism. It's gambling, guys. So this is what medicine is, and you don't want to do this to yourself. You have to understand balancing these things and not using any of these medicines and using natural techniques and supplements and meditation and cognitive behavioral therapy and really getting through. I think so many men, including myself, have had erectile dysfunction for performance anxiety and from just underlying depression, either mild or more than mild, or in general anxiety disorder. You know, if you're nervous, the sex, erections, and nervousness don't typically go well together. So I really hope this helps, guys. Let's get a lot of comments in this, you know, so because you guys just teach so much in these comments below. Men get to hear from you, and this is really a leadership. This is a real true brotherhood that I'm really running here, and I'd love to see you guys on the anabolicdocapp.com so I could really help you know how to utilize your healthcare resources. Thank you so much. This is what you get with the Anabolic Doc app. Number one, a digital history and physical exam. Number two, weekly Zoom meetings with me. Number three, discounted commercial labs. Number four, weekly member-only uncensored videos. Number five, Anabolic Doc's mailbag. You can't come to the meetings or you don't want to come to the meetings, you ask a question. I'm going to respond to your question by making a video, put it back up on the app, and you get to see your own question. Lastly, diagnostic and management library that is easily searchable by keywords.